This may be the
Not a
best
big
meal we've
eater,
ever
but I
had.
was standing in the dip.
This salad is like killer.
All right, everyone, thank you for bearing with us with technical issues and then also making sure that we have a quorum. Is this the first thing?
Yeah, let's take care of that so that we can conduct business.
So with our bylaws, we can have one of our members who are not physically present can be part of the quorum and vote, but we as the body present here have to vote on that by majority. So this would be counting towards the quorum. All those in favor,
Who's on the line?
Martha.
Martha, great.
Is there anybody else online, Krista?
DA on it, she's not on the list.
Okay.
With Martha, yeah.
Okay. So all those in favor of allowing our board member who
I would
is
say allowing Martha to participate.
allowing Martha to
remotely.
participate remotely, if you can please indicate. Anyone opposed? All right, so we do have quorum now. Welcome to the April Health and Human Services Board for Buncombe County. I'm Lucy Lawrence, our chairperson. Our first order of business is to review and take action on the board agenda for today. That is in our packet in front of you at your seats. And Krista emailed that to us last week. So I will entertain a motion and a second to approve today's agenda.
Make a motion.
Thank you, Greg. Is there a second? Thank you, Jacqueline. All those in favor?
Aye.
Aye. Thank you, Martha. Any opposed? Great. So we will move forward with our agenda. In accordance with the State Government Ethics Act, it is the duty of every board member to avoid both conflicts of interest and appearance of conflict. Next on the agenda is the review and action of the March board meeting minutes. And those are also in your packet. This was a virtual meeting that we had. And I will entertain a motion and a second.
I'll make a motion
Thank you, Jack.
to
Approve.
One moment. I'm sorry, this is Martha. Can everybody hear me?
Yes, absolutely.
It's a miracle. And I really appreciate you allowing me to participate from a distance, and I'm sorry I'm not with everybody today. But I have one request on the minutes, which is to add me to the list of those present.
You got it.
Thank you very much. That's the only thing I could see.
Just one clarification. I think, under the program committee updates, last meeting, it needs some statement from where it says my name and what I presented. We did actually not meet as a group. So just make that clarification. The committee did not meet, but we were continuing to review this stuff. So you can add committee update. The group did not meet, but reviewed this data.
Are there any other revisions or amendments? All right, so is there a motion and a second, please?
Second as amended.
Okay, all those in favor?
Aye.
Any opposed? Great, thank you. Stoney, I'm going to go off the agenda because we have a new face with us. And I think we probably do need to do some introductions. So if we can share our names and our position on the board, and if there's anything else folks want to share. And I'm happy to model. I do this for my students all the time. I'm Lucy, Lucy Lawrence, and I am the chair of the board currently. I actually am fulfilling the mandated social worker role on.
Hi, I'm Johnny Grant, and I am a board member.
And I'm Dan Frayne. I'm a family physician, and I believe I'm fulfilling the physician role
You
now.
are.
Is that correct?
I'm Steve Valeka. I'm the veterinarian on the board. I also have a background in public health before my vet career.
Hi, Betsy. Nice to see you in person. I'm Greg Nairn. I'm fulfilling the psychiatry position on the board.
Hi, I'm Kurt Euler. I'm a staff attorney with Buncombe County, and I serve as, I guess, legal counsel to the HHS.
Stephanie Bostic, I'm a board member. I'm Betsy Stockslager, and I was asked to join as a community advocate. I needed the language, and that's what it says I am. So I was trying to remember. Thank you for welcoming me, and I'm excited to be on the board.
Welcome.
I'm Jacqueline Hallam. Am I a community advocate? What am I?
Board, Jacqueline.
You're everything.
Extraordinaire.
Emeritus on that.
I represent the retired community. Oh, I beat you. We're on the retired community committee.
I'm Dick Needleman. I'm in the retired block and a community advocate.
Martha?
Sorry, I was muted. I'm Martha Salyers, community representative, and I'm on the cusp of the required block.
Thank you all. We will begin with presentations and updates, and we'll start off with our visitors from Advent Health, who are going to be sharing the proposal for the Weaverville Hospital.
Would you like us to join and speak from there or speak up at the podium? We can do either one.
It would be better for the,
Let's do it.
yeah, if possible. Or you can sit up here if you want
We
to.
feel very, very special. We can go back there. Hey, well, why don't we speak from here? Is that all right?
Oh,
Yes.
Mhm.
Well, we thank you very much for the opportunity to be here. It's quite an honor. I want to introduce my colleague. This is Jeremy Wild. He is really focused on our relationships with physicians and the community. My name is Graham Fields, and my title is really made up. It's assistant to the president, but a lot of what my role is on the administrative team is to keep us connected to the community for a variety of different areas. So it could be for community benefit. It could be for building relationships, government affairs, all this type of work. So we're honored to be here. And I have to tell you, as a native of Weaverville, this is particularly special to me. So if I smile, if I seem a little bit over exuberant, please forgive me. It's just kind of a after effect of the joy of getting to serve my community. So the reason we're here is what you have in front of you, which is an overview of the new hospital and the project. And I really call it sort of your hospital, because a hospital is not something that we build or that we invest in. It's something that the community owns and the community invests in. And so for context, I want to be keeping with time and not take too much, but I want to leave a little bit of margin just for questions, because your input is as important as our presentation. So the state identified 67 beds a couple years ago, and we listened, the community spent a lot of time meeting with different leaders in a 4-county area. So I want you to remember, it's Buncombe, it is Madison, Yancey, and Graham. And so before we start, I know that geographically, when you think about it, Graham is not contiguous. And so Graham has been historically associated with Buncombe and Asheville for its healthcare and certificate of need type planning for many years because it doesn't have a hospital. So those 4 counties are our focus, and we spent a lot of time visiting with them. And Advent Health felt like there was support to apply to build a new hospital. And so that was an opportunity to really bring choice and access and competition to the area. We applied, and had a lot of support from the community. And we were approved, and the state chose us to build that hospital. Ultimately, Mission HCA appealed that decision and sued the state. And so we went through a trial that was actually in Waynesville, and we finished up last fall, and I think October. And we're still waiting on that final appeal decision from the judge. And we feel like we'll have that. We thought by the end of this month that it may well begin the beginning of May. So our application is a little bit in front of you to give you an idea of what we're moving forward with. We have secured 30 acres of property, approximately 30 acres in Weaverville. So that's the exciting part. We're about 8 miles from downtown Asheville, about 6 miles from the Madison County line, and probably close to 12 to 15 miles from the Yancey County line. So if you're familiar with Weaverville, think about 2570. If you're familiar with where the CVS is, the Walmart is, we're on the same side of the road as CVS. There's a cement plant and there is a large tract of land there. And that is what we secured. And so we did that in our own name when we bought it, Jeremy. That was the ironic part. We thought we had time to acquire. In the spirit of transparency, when you sign your own name, you forget it goes in the land records and it's going to be in the paper. So, you know, we didn't do that with any company but ours. So the project moving forward, and that's what I want to kind of update you on, is maybe the timeline and start getting your input. That 30 acres is going to turn into a 67-bed hospital. So as you can see on the document, everything that you might find at our current campus, Advent Health in Hendersonville, probably a similar scope and size, will be there. We're going to create about 600 new jobs. And as this project keeps going, it very well could turn into double that or close to 1,300 jobs. So think about emergency department. It's a 12-bed emergency department. Many beds will actually be, I think, of great interest to Health and Human Services because the labor and delivery, the OB and the women's health, 13 of those beds will be focused on that. Additionally, a C-section suite that's dedicated for new moms. Everything you think of in an acute care hospital, so imaging, lab, med surge, everything that you would think through for that ICU. Our time frame at this point, assuming that the decision comes fairly quickly, we believe that we could break ground as quickly as maybe the very beginning of next year. Once that happens, it's probably an 18 to 24-month period. I would lean more toward the 24 months. I think about 2 years. It's about a $250 million project. And I think the big piece here is, and I'll stop and maybe listen a little more to some of the thoughts, or if Jeremy has ideas. I think the real work begins now, because it's easy sometimes to design a hospital, to just build the infrastructure, but to build relationships with the community, to listen, and really to say, this is a once in a lifetime kind of experience that we'll have as a community to build a hospital from the ground up. And so the more input we can have, the better. We're starting a process. When we first began, we did listening sessions throughout these counties. We're doing it again because there's an additional 26 beds that the state has identified. And if we are blessed enough to be awarded those beds, we would put them at this campus. My North Buncombe High School math says that gets us close to about 100 beds. And there's a lot of different service lines that are potentially available to us, from NICU to potential interventional cardiology, things that take scale. And so we thank you very much for your support for that. And please participate in these listening sessions. You know, we've got some scheduled and we're going to be promoting those in Weaverville, in Woodfin, in West Asheville. Also in Asheville, we have partnerships. I'd been for many years on the ABIPA board in Asheville. And so we want to work with the Shiloh community. That's our goal. And so we're going to have one at the Shiloh Community Center, the Weaverville Town Hall, Woodfin, probably at the library in Hamlet. And so really just, if there are audiences or organizations, Dr. Frayne, we're going to have a visit with ADCCM, with Western Carolina Rescue Ministries, even opportunities like this. We don't want to miss people. And we want to make sure that input is shared into the application. We've met with a lot of our higher education institutions, talking about that workforce and that pipeline. I was talking to Dr. Hoffman from Madison County and talking about a relationship with Mars Hill University. We talked about Warren Wilson, was with the Chancellor of Western Carolina. This is critical. And there's so many facets to this. I think the biggest thing we would tell you is that what I hope that you take away from that is a desire for you to be stakeholders. Healthcare is a ministry. You meet people on their worst day and they remember it forever. And so if you can shape that, that's what we want to do, is bring great quality healthcare, but also do whole person care that's mind, body, and spirit. So Jeremy, anything to add? I will take any questions. Tony, I don't want to take any more time than this.
We can, I can fill in with any questions y'all might have.
And tell me your role again?
My role is I'm in the business development marketing side of the hospital. So my focus is generally on the emergency department, primary care physicians, and cardiology. But I also get to wear another hat with Graham and some of our outreach and government relations and things like that, to do these kinds of things, community relationships. So
You got some good connections.
Well, I have a question. How did you come to the conclusion of a 67-bed hospital covering 4 counties and the variety of health issues that people have? Once you build 67 beds, it almost seems obsolete once you go full scale into the healthcare business for that particular facility. So,
Good question. It's a great question. You know, the state has essentially what's called the SHIP, which is a health planning council that determines the needs for beds, capacity, all those things. And so at that time, while we believe that obviously there was a much greater need, particularly in Buncombe County, Yancey, and Madison, only 67 beds were allowed and authorized for that. So we're probably going to have to do it in increments, right? If we're blessed to have the support of the community and people are willing to get involved and write letters and endorse that, I think that's why we were selected, honestly. I think the community made that decision. We're building this site, this 30 acres, for much more than 67 beds. And so the goal and the dream and the vision is to give people an even greater option for all those 4 counties. But you're right. You know, in comparison, 67 beds is not even a tenth of our colleagues at Mission. They're at 815 beds or so. So you see sort of the scale of that in terms of Buncombe County. There's great need. And I think if with the 26 beds, you start getting closer to that 100 and some of the service lines that we could bring. But it's a great question. It's regulated by the state.
okay.
To be clear, this is in addition to your Hendersonville campus.
Absolutely. Would be obviously their sister facilities and obviously would share some elements of scale. So it may be a physician group. I'll use an example. Maybe it's a Merge Ortho, maybe it's Southeastern Sports Medicine that they practice at both and would see patients orthopedically or ENT or cardiology or others. But it really would be a separate entity. Yeah.
And is there any plan to add psychiatric or behavioral health beds?
That's a great question. That's our top when we think about community health needs assessment. And I think about where I'm standing. You know, we work a lot in Henderson and Transylvania County and Buncombe when we develop ours. Behavioral health is number 1, substance abuse is number 2. 3 is nutrition, physical activity. 4 for us is actually putting in Buncombe's, which is prenatal outcomes. That's what we're adding to ours, and equity in that. The other is interpersonal violence and safe and affordable housing. So that is our top issue, behavioral health. And I think where it will come for us, and a question to you, is the hospital is the beginning. That's where I don't want you actually to be, and as excited about where it is. I think the physician practices and the network, the social workers, as we mentioned, will be even more important to keep people from ever seeing that hospital, however beautiful and proud I am of it. I think that will be how we look at whether it's intensive outpatient for behavioral health. One thing I'll mention, we just opened an adolescent behavioral health unit. Delina Lukowitz leads and helps us with that. She was not able to come today because we have another event. Actually, we sponsor the Safeline, which is Domestic Violence Prevention Agency in Henderson County. But Delina would be a good one to connect. We have 10 beds in that behavioral health unit. It's all for girls, 13 to 18. So a third of our beds in Henderson County right now, the facility you mentioned, those beds are behavioral health for women, inpatient, dual diagnosis for substance abuse or substance misuse, and also behavioral health. So if you see that facility in Fletcher, in Hendersonville, this will be very comparable in terms of size and scope as that initially. Sorry, that was a bigger answer to a simple question, but I hope that helped. Yes, ma'am.
How many beds are in Hendersonville?
103.
Okay.
And 103, well, like I say, a third of those, at least 30 something beds, are behavioral health inpatient.
And so your initial aim is the 67 beds plus the 23 additional
Right.
ones, so 93.
Well, 26, so it'll be
26.
26.
So
So
93.
The application is due in June. We are literally building that application. And we're grateful that county commissioners have shared it. Health department, the sheriff, others have put their voice to it. We would welcome that. That's, the selfish thing up my sleeve is that those letters matter. And then in July, the public can share any letter that they want. There's a public hearing. You can come and I would invite you to a public hearing, whether you're excited about us or somebody else. We expect that Mission will apply for those beds. And we'll plan to put them on their main campus. And, folks may want to speak on any side of that issue. And so we welcome folks to participate in that.
Just to give you a little idea, so with the original 67 beds, we had over 4,000 letters of support that we attached proverbially to our application to the state. And the analyst actually said that does and did make a difference. So the community voice is heard by those letters of support. So that's why when we ask, it's not just, hey, yeah, give us a letter, we're, great. It really does mean something. It really does make a difference.
He's right. It was incredible in the trial with the state and with others, but the analyst said it was overwhelming. And I saw this, and you can't help but notice that. So we're grateful. That's an honor, but it also charges us, Jeremy, to keep these dialogues going, right? Because that is a sacred trust when people say, I'm going to trust you to do that. So, yes, ma'am.
So I know demographics in West North Carolina, we have a large and growing older adult population, and Advent Health in Henderson County had excellent specialty services for years, serving folks with dementia and family members, caring for those folks. Do you have any are you considering pulling that expertise into this new hospital as well? Are you still going to emphasize older adult?
That's what we'd love to talk about. So if we brought Dr. Anna Hicks, who is leading our age-friendly initiative, we don't hold a candle to her. She's incredible. And she is leading that to make all of our practices focused on that. And so she would be a great one to meet with too. But your question is more on the behavioral health side for older adults as they age. I don't know, but I would love to kind of take that question as a suggestion to say, how can we look at it as, how do we address dementia and Alzheimer's as people age? Because those two units, you're right, that full unit now is all women 18 to 65 or 13 to 18. And so it's almost figuring out what aspect of behavioral health, you want to address. And our calling has been women and addressing that, but you're right. And I think Dr. Hicks would second that.
Absolutely.
I think it's a great suggestion.
I have a question from Martha on.
Sure.
Hi, I'm sorry I couldn't be there with you, and thanks so much for joining the board. I have three brief questions. One is, I heard you talk about perinatal outcomes. You will have OB services, and how many beds will you have for OB?
I think it's 13. I think it is actually, it's 12 beds for the emergency department. It may not be on the back, but it is 13 beds of labor delivery, dedicated C-section suite, and of course, all of the OBs, and again, it may be practitioners, it may be nurse midwives. One thing I'll mention too is that what's very important to us is also our community benefit group. a not-for-profit. And so without, basically you think about their stakeholders instead of shareholders. And so I feel like I'm talking to her in this thing. I'm sorry. I feel like I'm looking up. But I think the biggest piece is we accept all insurance and no insurance and Medicaid and welcome that. And we want to treat people with the same dignity and respect, whether they have insurance or not. And when we think about outcomes in prenatal care, that's something that it actually haunts me, because when I was on the ABIPA board, we watched a movie, a video, a miniseries. It was called Unnatural Causes.
Yes.
And Unnatural Causes haunted me because there was a section in it, and forgive me, Stoney, I'm going off the path here. And it was called When the Bow Breaks. And it haunted me because in every medical outcome, it was income and education, and it got better, except for prenatal outcomes for African-American women. And the outcomes, the chances for a preterm, premature, all the consequences you didn't want are actually lower for a high school dropout, Black female, than a master's degree level African-American female. And that, it gives me chills to this day that they did every kind of research, everything, and came back to this was something that was driven in society. This was something that had happened that was in the built environment that wasn't around the world. And so for us, it's trying to build that into the OB practice, the primary care practice. I'm sorry, that was my soapbox, but that part of that video really had made an impression on me. So we're trying, Stoney, to build that priority into labor and delivery and make sure that we're treating everybody as equitably as we can.
Martha, you had two other
Yes,
questions.
thank you. That was part of why I asked the question. The other part is because Western North Carolina, aside from Mission, is essentially an obstetric desert. And even though you all are located right in Weaverville, which is almost in the lap of Asheville, it may help some of the obstetric desertification. Well, Harris, I know, has services, but yeah, there's a tremendous need. Two other quick questions. Will you accept helicopter transports?
You know, we certainly would. I think it depends on the acuity of our hospital, what role we play. We want Mission to be strong in a tertiary facilities. Our goal is not to duplicate those services at that high level, but as an acute care hospital with the potential of NICU or interventional cardiology, certainly, it'd also be in relationships with these medical centers that we may need to transport someone, to be honest. So I think it would be a mutual relationship. Some of what we're trying to do too, to be honest with you, is by bringing that emergency department. One of the greatest statements that we heard in our listening sessions was from a Buncombe County paramedic. He looked at me and he said, Buncombe County doesn't have a hospital. And I thought he was meaning it sarcastically. And I said, I'm not here to disparage or cast aspersions. He said, no, what I mean is, he said, we don't have a local hospital. We have a big regional hospital that serves 16 counties. So when my Nana breaks her leg in the garden on Ox Creek in Weaverville, and they bring her, we get in line behind what could be Haywood, Cherokee Indian Hospital. It could be Madison, Yancey. And he said, so Bunco's in line. I mean, no offense to any of those other communities. We don't have a local. And so he did it kind of like airports. He said, imagine that in New York or London, everybody, domestic and international, all went through the same airport logistically. So we're all at Heathrow, whether we're going to Dublin or whether we're going to Tokyo. It doesn't matter. And I think that would be offloading some of that local volume, allows Mission to have that opportunity to, when those hospitals do need to fly or transfer, it takes some of that local traffic out that we'd be able to handle. So I want to be honest about the helicopter. I think we still obviously want to support Mission as the tertiary facility in this area. We need them to be strong.
Okay, my last question is very short and related. Adding a hospital is going to put an increased burden on Buncombe County EMS. What kind of work are you doing with Buncombe County EMS and emergency services to assure that there will be enough staffing and other abilities within our emergency services?
Fantastic question. It's a great question. The EMS and paramedics and fire, what they do may be as important or more important, quite frankly, than, what they're doing in the house on the side of the road than what we do in the emergency department toward that patient's outcome. And one of the things we've done is we worked a lot with Taylor Jones. He is a real connection back to the community with Jamie Judd, and also, quite frankly, with Avril. Avril is a visionary and I think is planning and thinking about this too. And so we want to partner and make sure that whatever we do in terms of infrastructure, that we work together to develop that. And we're already in those conversations with Taylor, Jamie, but particularly Avril too. One other thing I'll mention too is that for that, we're also working with AB Tech, both in Madison and in Buncombe, just to talk to the paramedic program, just to talk about, we may even share paramedics where they work in the emergency department and some on the truck. And so absolutely, the paramedics will be key. And I think with North Buncombe being a very growing area, I think Buncombe is excited too about potentially a new location for, opportunities to grow. I think there's a lot of different possibilities. Those are good questions. Thank you. Yes, ma'am.
So you all have 30 acres.
Yeah, roughly. It's about 30 acres.
And so my question is more related to workforce.
Yes.
I mean, we are all acutely aware of the housing crisis that we have here in Buncombe County. And I'm just curious about the possibilities that you all are thinking about on those 30 acres about having staff housing.
I think everything is on the table from the standpoint of visioning. I don't know if we would have enough room to really do something quite that visionary, but I mean, those are the kind of things we need to think about. Because again, as goes our facility and our organization is at the heart of our workforce, particularly nurses. I mean, I appreciate everybody, but nurses are the ones that are so key and fundamental to keeping patients healthy and safe. And so anything we can do. I mean, I don't know that that's enough property, but I can tell you we've got to think creatively. I mean, we really do. I mean, it's one of those things that we heard that in Madison and Yancey, even as they talked about where people would live. They want to keep their own talent and their citizens in their communities and want to live there and work in Weaverville.
Well, and I selfishly am thinking about my graduates from Warren Wilson, who would be fantastic employees. But so many of our folks are saying that housing is keeping them from staying.
I'm thinking.
And I think on the flip side of that, and I agree with you, yes and amen. One thing that you've heard from the other counties, they're facing the problem of so many of their graduates or so many of their people are leaving to go to school somewhere and not had an opportunity to come back to their communities to work. There's nowhere for them to work. So they're losing that young talent, right? Well, something like this hospital will give them an opportunity, especially those that are interested in the healthcare field, to go to school local and then stay local, right? And many of them have the opportunity to stay, right? They're not moving in, they're not transplants, they're actually locals. We're excited about that, but to your point, yeah, that's in every conversation if you want to call it the HR level, we're all talking about that. How can our people afford to live in this community? But also with the hospital in that Weaverville area, Graham mentioned there are layers that go out from the hospital, right? The hospital is kind of like the Alamo. That's the last place you want to go, right? We want to provide care out in the community. So that's 5-mile radius, 10-mile, 15, 20. So then you think about things we can provide in those out, the Mars Hill, the Burnsville areas of the world, right? And then out in those communities, at least I think it's a little more cost effective for people to live at this point in time. But I know you got a view or water, right? Then it's going to be a little more expensive. But we're thinking through and talking to some of the local municipalities about this stuff.
I mean, those are exactly questions that I think this is an ongoing dialogue.
Yes.
I think that's kind of our thought is please allow us to have, if there are other organizations that you represent, please make the introduction. I mean, This is an ongoing relationship for a long time, and this is sort of the beginning of it. The other thing I would tell you is, you know the needs of the community a lot better than we do. And so this could be talking about the nuances of West Asheville versus North Asheville versus Woodfin versus Swananoa. And so please teach us if there are specific things or service lines that you want to see in those communities. The other thing is a not-for-profit. You know, there's only 3 buckets where our resources can go. We hope to be successful and have resources to give back. It's either in compensated care, right? That is one option. We can build something. This is the community's hospital with the community's money, or we can partner, sponsor, donate, and give back. And so I think that's where we need you to hold our hand and help us. The biggest question though is who's missing, right? What voice are we missing? What is it that we think we know that we don't? And so I think that's where I would ask you please to pull us aside and say, you know, be purposeful in meeting in this community, this neighborhood, this organization. Thank you. What an honor. We really appreciate it. Thank you.
Thank you all. Right. So next on our agenda is an update from Martha Salyers on the Land and Labor Acknowledgement Ad Hoc Committee.
Thanks, everybody. And first, I will say that this is a lot more complicated than I had thought it was going to be. And the delay in producing anything is largely on me. But I will report that we have made overtures to the Equity and Human Rights Office in Buncombe County and have actually had 2 meetings with them besides the meeting that we had with Drew Reisinger and Dr. Norrell Armstrong. Also have made overtures to UNC Masters in Public Health Program and the Eastern Band, and those are all in process.
Great. We look forward to an update. Is that going to be next month?
I hope so.
Awesome. Thank you, Martha. All right. So we are moving along to old business and the topic of oath of office. And Stoney, is this you?
Yeah, I think we finished last month, and if my memory serves me correct, we talked about, Kurt gave us a good recommendation, is that what we're really voting on, if we want to include an oath of office in membership of the board, is simply updating our board operating procedures, which we do every year in July. So I guess the issue before us is, and I guess we would take a motion a second, one way or the other, is do we want to amend our board operating procedures so that annually, I guess, or when we have new members. So if we have a new member come on mid-year, then they would in essence take their oath at their new member orientation. And then Kurt, you help me with this. I don't know that we would need to do it once a year, or would it only be when people are reappointed, then we could do it annually in July and do our oath of office there.
I mean, I would think that everybody would take their oath of office when they are before their first meeting.
Okay,
They do not need to take another oath of office.
so you don't need to do it twice.
Even if you have been reappointed, you are still in the same seat that you have taken the oath
You're
to. So
good as long as you.
I just think the thing is before you were able to serve as a member on the Health and Human Service Board, are you required to take a oath of office?
Yeah, and that would really be a change in our operating procedures. This is how we would operate. So I think that's the issue before the board, rather to change our operating procedures and move to that practice, or to remain as we are and simply not take an oath of office.
If I recall, that one of the reasons why we tabled this and we keep tabling it was that there was a desire to make sure that people had an opportunity to voice dissent. Have you received any voices of dissent anonymously, or any conversations, either Lucy or Stoney? Anybody voicing any concerns? No.
But I welcome those.
Well, I know, but that was our plan over the last, since between the last meeting and this meeting, is to be able to know whether there was any concerns that were not voiced in person.
No.
So far, none.
I have a question. And I guess it's to Stoney and
Me, Kurt.
too. How do you deal with of offices in regards to people with different religious beliefs? Like
No,
if
I mean, I can say,
Islamic beliefs, those with, you know.
once again, the oath is not, once again, you could either swear or affirm. You don't have to use the Bible as the thing. So it's not really, and the oath is not really to allegiance to a particular God or a particular religious thing. It is really an oath that says that you will support and uphold the federal Constitution, the North Carolina Constitution, and the laws of the state of North Carolina. That's basically what the oath is basically stating, is that you will uphold to the best of your ability the laws of the state and the Constitution.
Okay, well, I just wanted that to be out there.
Oh, yeah, but no, so you're not, affirming an oath to, Christianity or a particular religion. So but I think that you could affirm in whatever your religion, if you have a particular practice, we can accommodate that in taking the oath. We wouldn't force you to swear on the Bible if that's not with your beliefs, or, we would work with you. But basically, you're just agreeing that you're going to follow the state laws and the Constitution in your job.
Okay. I think just remember we said this last time too. It's, and Kurt did a good job of helping us with this. It's not specifically required in the consolidated statute that board members take an oath. But it's one of those interesting caveats in the law. When counties were allowed to consolidate, certain things were really not addressed in the consolidation statute. So whereas if we were still a county that had a board of social services and a board of health, each one of those boards would take an oath. You're a consolidated board, and the law did not address that. So roughly in North Carolina, about 2/3 of the consolidated boards do choose to take an oath and see their consolidated board as an official board of the county. But really some people, and this is where I lean on Kurt, really you serve as a body of the county commission. So they're appointing you as an advisory board. They all take an oath. So you could make the argument under consolidation that the commissioners, for lack of a better word. So that's why I think most counties leave it up to that specific board, that unless it's a county ordinance in a county, that they leave it up to the individual county. So this decision really is the board's decision. I really brought it to you when I was doing research on several board issues across the state, a little bit in my role as the lead of the Consolidated Human Services Alliance in North Carolina. And it just came back as a strong recommendation, not a requirement, it's two different things, from the School of Government, that all consolidated boards take the oath. And I just brought it to this board as a result of that research. And I really think it's your decision. I want to put that out there. I don't want the board to feel pressured into it. I just wanted you to know what was happening across the state, where the legal caveat, it's a statutory issue where we didn't really build out that consolidated statute in 2012. And so just wanted to bring it to this board for a decision, and really it's your decision to make.
So do you need a motion?
If we're going to change our operating procedure here, right?
I'll be, we don't put it to a vote today.
Do you want to put it in a vote today?
I thought that's what the last.
You have a quorum?
I mean, I think that's what we're
Last
gonna do
month was.
otherwise. So I'll make the motion. I move that we go ahead and amend our board operating procedures starting in July to include an oath of office.
Thank you, Dan. Is there a second? Thank you.
Seconds.
Thank you, Martha. All those in favor, if you'll please indicate, I guess raised hand is good, Martha.
Can I ask
Yes.
just one question as to when you want this to go into effect? If
So
it's all right, if July 1st would be the date,
Yeah.
and then anybody appointed after July 1st would be required?
Correct.
Okay. I just wanted to be clear on that.
Okay, all those in favor, if you can indicate.
Mm.
Opposed? Abstain? Thank you. We have one abstention. It looks like this vote passes and we will now be sort of an official board of the county. And when we meet in July, this is sort of our annual meeting, we will all be taking the oath of office together.
So just point of clarification. So what the motion was is to amend
Uh-huh.
and so that will still have to be approved when we go through in July to approve the board operating procedures. So we're giving you guidance to amend our board operating procedure that we will then have to approve starting for July 1st, correct?
That's correct.
Because technically speaking, it wouldn't begin until July 26th, because that's when our July board meeting is.
Mm-hmm.
Because that would be your official vote to change the.
Yeah, so
BOP.
Okay.
that's when it'll happen.
That's fine.
Yeah.
That's fine.
Thank you.
Wait, I'm sorry, Mrs. Martha, could I ask for one clarification, which is, did I hear the wording right that all new members would have to take the oath of office, or all members as of July, including current members?
I think the intention is that all members,
Yes.
but if somebody starts their membership this meeting, it's not in effect yet.
Yeah, but I just wanted to make sure the wording said forced institution in July includes all members and not just new members.
Yes. And then those who join after July will also do their oath, probably during orientation. Or their first meeting, yeah.
I just didn't know, and I'll just throw this out since it's not really discussed. Do you want that to be where anybody can take the oath of office July 1st? But I guess my question would be to you all is what happens if you have a board member, let's say, who is currently on the board and doesn't want to take the oath of office? Would that person be, I guess, what in the term we say, would that person be grandfathered, or would that person, since they are already have a seat, they are already participating, they would not need to take that oath of office?
I think we discussed, I mean, so if we're open for discussion, I think that the board operating procedures will be clear that all members take an oath of office. And we discussed it last time. I think, we had some in-depth discussion about the pros and cons of having the option for some to opt out. And it seemed to clear to me that would not be a preferable option. That if we're going to do it, we're going to do it all together. If we're not going to do it all together, we shouldn't do it. It should be an all or none thing. Otherwise, it'll create some weird dynamic whether even in just perception.
I guess the only that I have about that is like when I applied to be on the board, that wasn't a requirement. So it feels like to retroactively require it feels like that. I still like the idea of leaving it open. I mean, I'm not saying I'm not into taking the oath, but that wasn't something I agreed to when I initially
Well, so if that is true, that, so this is where the discussion, if somebody is not wanting to take the oath, then somebody should be voting against this change. And so far, nobody's voting against this change. And if we, I mean, and so I think all of us, if somebody said, no, I don't want to do this, probably I'll say, well, let's not do this. I think we're pretty amenable to that. So, but so far, nobody is saying, I don't want to do this.
I'm not averse to the oath at all, but to require something that wasn't originally required when someone applied to be on the board. That's what, I guess, the step that I'm disagreeing with, not the oath itself, but changing a requirement after someone has already made a commitment to the board. And because board membership is time limited, it makes sense that if we're starting in July, after so many years, those folks who didn't take the oath wouldn't miss the opportunity to continue to participate, nor would they have to go against what they feel is right. I mean, they'll eventually rotate off. So it doesn't seem to be any harm not to allow folks to make that choice who are currently on the board.
What do you guys think about that?
I'm totally with her.
Yeah.
I mean, I guess the reason I bring it up is that I always err on the side of that there's probably, especially with these things, there might be somebody who just doesn't want to take the oath. And I think that you need to fully think through what that requirement means. I do think that it's better that all of you take the oath as opposed to you not taking the oath. And if that's how you want to word your motion and whatnot, that's acceptable. But I do, in most of the time when we have requirements for certain governmental things, that we try not to apply them in it's more difficult to apply something retroactively than it is from a date certain moving forward.
Well, Kurt, just tell me, what does that requirement mean? Does that put us under some type of covenant with the county? Does that give us protection against lawsuits? I mean, just tell me.
So you're asking what's the why, right?
Well, I think the idea is since you do have some legislative ability, right? You all can create and pass public health rules and things like that. The idea is that by taking the oath, you are basically saying that you will, abide by the Constitution of the United States, abide by the state constitution, and abide by the North Carolina general statutes. That I don't think provides you with any immunity, whether you took the oath or not. If you pass something that, is clearly unconstitutional or whatnot, that's going to be a problem, whether you took an oath or not.
Right.
So, really, I think the issue is to kind of let the people that you are doing business on behalf know that sort of I am agreeing to these rules. That's kind of how I look at the oath.
Okay.
And that if you, deviate, and I want to be careful given today's political climate and what I think oaths are looked at very differently, given what's gone on in Washington, DC. So that.
I mean, my sentiments exactly.
I just want to bring up since it appears that a couple of people are not necessarily interested in taking an oath of office, if you could you just draw up an oath of office and just send it to us? And maybe we just need to see what the oath says. Because I mean, you're making references to what a possible oath might say, but maybe just
if you want to give me a second, I'll be happy.
Send it to everybody. We can read the oath. It's kind of like more concrete.
We can do that.
We should already have.
I can read you what
I don't remember
the North Carolina
Not us, but.
standard oath of office is.
And I have a copy of what was sent out last month. And can I read it, Kurt?
I hope that's right. Yeah.
Buckingham County Health and Human Services Board Oath of Office. I blank do solemnly affirm that I will support and maintain the Constitution and laws of the United States and the Constitution and laws of North Carolina, not inconsistent therewith, and I will faithfully discharge the duties of my office as a member of the Buncombe County Health and Human Services Board and disclose any potential conflicts of interest that may exist. So help me God.
Thank you.
Yep, that's pretty much the standard state of North Carolina oath.
That's what I was gonna ask, if that is what everyone else, what the other boards are doing, that are doing it. Cause every board is not doing it yet, right?
Correct, but
But
2/3
we're
of
trying to
consolidated
move toward
boards
that.
are.
We're trying to move toward 100%. So we'll be consistent in the way that we do business for the state and the county.
So back to your point, Stephanie, I am concerned about the appearance of whoever wants to abuse what this appearance would look like if we're not all doing it. You know, so just have the scenario. So we create this rule. Moving forward, we're going to take an oath. And none of us actually take the oath. So we just created a rule that none of us actually did. Anybody coming in has to do it now. And so that's kind of weird. And so we're opening that possibility to do that. So second is say all of us but one does it. And something happens and somebody wants to attack this board and they are going to attack the person who did not take an oath. You know, and so we're kind of, it's setting up a weird risk of a dynamic that for some reason, I'd rather us not do it at all than for some people not to do it and some people, I don't think it matters so much. It's better if we all do it versus we all don't
Well,
do
wait
it.
a minute, how do you come to the conclusion that someone's gonna attack the person that didn't take the oath? I mean, how can you project that? How can you
I'm
foresee that?
just imagining.
We're gonna pass a law.
Imagining. I'm just imagining that it's a possibility.
I feel like what it represents is that we're looking at how to progress and what we want to do to change as a board. And we're also honoring and respecting inclusion of all of the individuals who agreed to participate in the board. So if anything, it shows a strength of allowing all opinions and ideas to exist. Because I don't see, if we're willing to not do the oath, then there's no harm in one person not taking the oath. I think it speaks to more inclusivity and progress.
So I would think that the inclusivity would be handled at the time of deciding to say the vote should be required. So this is the inclusivity part. And I am trying to promote, the reason why I did the motion is that I kind of felt like everybody said we want to do this. If there was one dissenter, I would actually say we shouldn't do this. I asked whether or not there was anybody who said dissent. And the answer was no.
I guess I didn't clearly understand the vote then, because I thought from last month's discussion that there would be that grandparenting and that it was for all new board members and existing board members had the choice. So I was unclear in what the vote was on. And I would have voted differently.
Well, then with that then, because that's what I was trying to get somebody to say. I actually I would like to say that I would move that we don't do this. If that is the dynamic, I don't think it's healthy for this board to do it.
I apologize. I was not here last month, so I wasn't part of that discussion, and I just walked out and I just walked back in, and I missed that part of the discussion too. So, but
You're now board chair.
but looking at this from a philosophical standpoint, And if we acknowledge that there is some legislative responsibility that we accept by coming onto this board, by setting policy, et cetera, there's a responsibility in being on the board. And if we have answered the question that it's not religion-based and there's not a Bible involved, and if we could even remove the part that "so help me God," for those who might find that to be offensive, it still comes down to the fact that the oath is saying, I commit to something and I agree to the rules and the Constitution of the government for which I am serving. I commit, and therefore I promise. And that just basically requires a personal ethic. You have an ethical sense that allows you to promise anything. And why can't we all agree that when we join the board, we ethically promise to do our service here in light of the rules of the state and the nation? So
I guess as I interviewed, you all determined whether or not I was reliable and trustworthy enough to participate in this role. And I understood what was asked of me. So a formal oath feels, I'm happy to say publicly and out loud that I'm going to live up to my own ethics and the laws, because that's what I understood coming on. But I guess I don't know that a formal oath should be required for all people because, again, I may not understand all the reasons why that wouldn't feel right or okay. And I guess if I'm making an oath, I definitely want to be certain, like 100% certain, or else it's just like lip service, right? So if anyone has any hesitancy, I think it would be more ethical for them to say, I prefer to participate in the ways that I agreed to when I first joined the board, but I'd rather not take this formal oath. It's not I guess where I hope I'm being clear. I don't disagree, personally with the oath. The part that I disagree with is asking people who were not required to do so, who currently are valuable board members contributing, to potentially discharge those board members because they don't want to take the oath. It seems like that would be unfair.
well, devil's advocate. Can't be 100% sure about anything, so that can't be the standard. Secondly, an oath is what you do. It's what I do. It's what every individual board member does if they are going to assume responsibility. So it's your commitment to the board, to the county, to the state, and to the nation. I mean, it's something that you offer. It is your promise.
I agree. Moving forward for progress, I totally agree. That's something that should be acknowledged up front as people are applying for a seat on the board. I have no disagreement with that. The disagreement is to ask people to change who may not be willing to do that now after they've already agreed to participate.
Counterpoint. If someone were to agree to join the board for the reasons that we state, and we say, moving forward, this is what we require, should we not know, should that person not come forward if they're not willing to make that oath?
Right, if it's a new board member, yes,
No,
that's
I'm talking about in retrospect, because it's an assumption that we are all on the same page.
We're not.
By serving.
I don't believe we are. And so that's where I have a concern that we could potentially lose a board member if they weren't interested and willing to make the oath, if we made it retro. And again, working in government, environments can limit and inhibit people from participating.
Maybe they can type it up.
If it's a strong recommendation, that's different. That allows room and space for inclusion.
I couldn't find it.
So if it's an unnecessary requirement that we're imposing and it's not legally required, I guess
I think I fall back with Dr. Freeman on that question about, I'm very hesitant about moving forward with one set of requirements and yet being inconsistent about the people who are making now that decision and not making it inclusive of everyone, because it just doesn't make logical sense.
That's what, it seems like that this is the time to make that decision.
yes.
And so based on what you're saying, which I don't disagree with, if that is the sentiment, then I would suggest, be my say, we don't move forward with an oath of office. You know, I think we don't have to. Sony said it's up to you. And it seemed like everybody was in agreement, but now it's clear that everybody is not in agreement. So how would we want to move forward and create problems? Like this is, we've already spent too much time on this as it is, because it's not necessary. You're saying that we already kind of have it in our brains and this is who we are. And so let's just keep doing what we're doing. I mean, why would we rock the boat?
Why don't you just grandfather people if they don't want to do it, and whoever wants to do it just does it? And if this is time limited, eventually we just do it.
Stephanie brought that up.
Yeah.
Yeah, because how long is our terms?
Well, that's a good question.
But I mean,
Yes, and so,
why can't you just do it like that?
Well, I think it sets us up for some risk. I mean, I'm just, because I like to think about all the
Yeah, but
possibilities.
what could the risk be?
But the thing is, there are people here who have taken oaths, like the Hippocratic
Yeah.
Oath. I mean, a lot of occupations have oaths. I mean, if you have never taken an oath before, I could understand why you might not want to take an oath now, but you took an oath,
You know,
you took an oath, I took an oath.
I think a compromise to meet both needs
Yeah.
is, you say that the terms are 4 years.
Yes.
What if we said that 2 years from now, this will take effect? So it will give anybody, you know, so maybe it would cut somebody's term just a little short. And anybody who's being reappointed knows this is coming. And if they don't want to do it, they will then have to drop off and not be reappointed, you know? So it'll be a 2-year kind of anticipating that this will happen in 2 years. And that will give enough time for it to shuffle out. And then everybody starts together at the same time in 2 years.
So Dan, are you saying if a person has time left on the board and they decide to not take the oath, that they wouldn't be considered on the board again simply because they didn't take the oath?
Well, I think that's the question, is that if it's part of the bylaws, if it's part of the operating procedures, right? I mean, that's what you're saying.
Discriminatory. You're saying.
Well, not if it's part of the.
I mean, not if it's part of the state. I mean, if the state is requiring it, then if you're gonna serve in that capacity, then if you choose not to, then why would you want to be on?
Religious aspect.
Okay.
I didn't
What if I'm Hindu? What if I'm Islamic? What if I'm from
But I thought
another religious background?
That question was answered by Kurt, that it's not a religious.
That's
thing.
not religious.
Take the word God out.
Yeah, I don't say it.
I didn't feel that.
Yeah, I don't, I think it's an oath to the
Yeah, we already
Constitution,
decided.
not.
Well, it's not even an oath, it's an affirmation. That's what, it's not even an oath.
Yeah, so God comes off.
Yeah.
I mean, that's not a question.
It doesn't say I swear.
That we
It says,
delete the
"I
still helping
affirm."
I
God.
affirm.
That's at
Right.
the end of
Just
this.
saying you're gonna do your job.
Yeah.
So it sounds like maybe it is an affirmation of office
Yes.
rather than an oath of office.
Mhm.
What's the difference?
Oh, sorry. I don't have access to that. Thank you. Yes, Martha. You might be muted, Martha.
I got it. It took me a second. I was going to say never mind, but just wanted to bring up that anybody who's ever served on jury duty has to take an oath. If you work for the election board, you have to take an oath. I'm echoing Dick here. I had to take the Hippocratic Oath. And a lot of those things include God. The constitutions include God. So there's really, you know, so that I don't think that the mention of a higher being is a limiting factor, because we all have, I believe, have compromised in terms of that. But it's supposed to be non-denominational, and God is supposed to mean whatever it means to each of us. I agree with Dan that we should be all or nothing. I believe that this oath/affirmation is simply an expression of our ethics, and that we're willing to stand up and say, yes, I am going to perform in an ethical fashion to make public health rules and to make health and human services decisions for this community, which is something I thought about long and hard before I even joined the board. So if we all thought long and hard about that before we joined the board, and we're fulfilling our duties, then for me, it's not an issue to take an oath. But I understand that for some people it is.
So Martha, just to emphasize Stephanie's point, is that what is your thoughts about this idea of grandfathering in people who are currently on the board versus requiring it for even though it wasn't required when they entered?
If that's the compromise that we need to make going forward to have an affirmation or oath of office, I would accept that.
I could think of one other thing that you grandfather, but it's to your next, until your term, that you take the oath every time, so if you have a 4-year term, you take the oath. And then if you get reappointed for another 4-year term, you have to take the oath again. You could do it that way too. You don't have to, but that way you could basically, the people who have already are in their term and they, for whatever reason, don't want to take the oath, they're fine. But if they get reappointed, then they would have to take the oath.
Is that how county commissioners do it? If you're elected for a second term, you take.
I think county commissioners are required to take the oath of office. I don't think there's any, there's.
I mean, if they're elected to a second term, do they take it again?
I am not sure. I know that when the sheriff was reelected, he did take his oath of office again, although I don't think he had to. But that is definitely a question.
The reason I was asking, I was just reading from this is for requirements for local social services boards. One of the boards and it says, as public officials, county social service board members are required to take an oath in which they swear or affirm that they will faithfully discharge the duties of their office and will support and maintain the Constitution and laws of the United States and North Carolina. Board members should take this oath prior to assuming office. The oath may be taken at any time between the date when an individual is appointed to the board and the date when the individual assumes the office. And then it says it tells who can administer it. And it says if a county social services board member is reappointed for a second consecutive term, the board member should take a new oath of office and file a signed copy. County commissioners, but that's for a social services board. And although you do hold all those duties that a social services board holds, except for you don't hire, fire the director. So I think this is what's causing the confusion in North Carolina. So you've got statute concerning DSS boards. You've got statutes concerning public health boards. You've got statutes concerning Board of County Commissioners. You have no statutory reference to a consolidated human services board. And the only thing the law says is you shall assume all the duties of a public health board and a social services board. It doesn't say you shall assume the need to take an oath, but I think the school of government.
Says it's implied. It's implied.
When you assume those responsibilities, it is in your best interest to take the oath. But again, it's your decision. I certainly did not mean for this to be a dividing factor for the board. I feel a little badly. I just wanted to bring it to you because it's a discussion that's going on all across North Carolina. Is should consolidated boards operate as health boards and social services boards, because they in essence are both. Like we're a consolidated board we do all of that, but we don't take an oath to uphold the Constitution. And I'm certainly very sensitive to religious exemptions, personally and professionally. So I just think that it's something for the board to decide. I don't know if anybody else, one thing I would say though is it is going to be unique if you don't stand together. Because an oath is a commitment. You know, back to what Greg said, an oath is really a commitment. You can call it something else. And when I join a civic organization, I have to make a commitment to abide by the rules of that organization. So if we're gonna do it, I personally would recommend it's everyone because it just would seem awkward to have some people committing to follow the Constitution and some people not on the same government board. I just think that might be a little bit
I guess
unique.
the commitment's implied, it feels more like a public voicing expression of the commitment.
Yeah.
And so when I think about a religious exemption, that's the issue, is the public expression of an oath to something that might
Yes.
it's not that the commitment doesn't exist. I think that commitment can be could be expressed in a variety of ways.
Yeah, I mean, I don't disagree with you on that.
It does sound to me that, and correct me if I'm wrong, but that we as individuals might need to percolate this more. And spend a little bit more time thinking about this. I would welcome individual discussion and questions. I would also welcome any private individual, and I would also open any of us who want to maybe do open email exchange. So when we come together in April, which will be virtual, that we can move forward.
So just a point of order, we did vote on something.
You need to.
So can we,
So you
can we,
need to have a motion to rescind or repeal the prior motion made.
I would like to make that motion.
second it?
All those in favor of rescinding the previous vote on the oath of office? Any opposed? Any abstentions? Okay, so our homework is to percolate.
And can I just say that if you all, you need to be careful about how you're communicating because you don't want to violate the open meetings law.
Thank you.
So I would probably suggest that if you have comments that you send them to the chair and so that she can distribute them out. But what we really don't want is to have like this big email where you're all kind of deliberating in that email and not have it announced as a public meeting so that then with any of those counts, you can come to this is April, so the May meeting. Get my months mixed up, but we'll come to the May meeting and then you can have a deliberation because really your deliberations on this issue should be in an open public meeting.
Thank you. Thank you all for your thoughtful consideration. I have a short bit of new business. Our executive board interviewed the someone for the statute mandated dentist position on the board. And exec spoke with Dr. Casey Metcalf, who is the dentist with winches, or Minnie Jones. And Casey was very enthusiastic about this position on the board and feels that she can be a voice for population members who are disenfranchised, underserved, and underrepresented. Yeah, anyone else from exec want to add anything about our conversation with Casey?
He also is from Boone and is educated in North Carolina, has returned back to the area and seems to be very invested as a professional in the area. So I think that's worth noting.
I'll comment. I know Casey. She would be a great addition to the board. Winch's is the largest provider of underserved dental care in our region. Last year, they had a wait list of 3,000 people trying to get in, and they're desperately trying to increase access and improve. And and she is the leader of that dental operation. So she would be a great advocate and member of this board.
I will entertain a motion and a second to approve Casey Metcalf as our mandated dentist on the board. Thank you, Johnny. Thank you, Dick, for the second. All those in favor, please indicate so. Any opposed? Any abstentions? All right, so we will look forward to welcoming Dr. Casey Metcalf at our May meeting. All right, Stoney.
Okay. So just have a couple of things to report. We're obviously deep into the budget. So we've submitted our first pass budget to the county manager's office, to the budget office. There was a budget workshop with commissioners after the first pass. The county revenues, and I'm certainly not the budget officer, so I'm gonna give you the high level. But in the first pass budget, our revenues are coming in much below expectation in this fiscal year, which would, help us project next year, especially around sales tax. So Buncombe County's had quite a drop off in sales tax from what we were expecting. Some of our intergovernmental revenues are also diminishing this year unexpectedly. One of those, and this is going to be a little hard for me to explain simply, but we have something called Medicaid Hold Harmless, and this is an agreement that the state made with counties years ago. Counties used to pay a portion of the Medicaid cost in their county. And there was, I might need to get Lee to help me here, but there was an agreement made years ago that actually it would come out of your sales tax instead. So if you paid more sales tax than you would have paid under your Medicaid payment, the state would hold you harmless. They wouldn't make you pay more than you had to. And they would give you that money back, give you that difference back at the end of the year. And it could be a lot of money. It could be millions of dollars. So the last couple of years, we've gotten pretty substantial Medicaid hold harmless in Buncombe County because of pretty robust sales tax being a tourist economy. This year, with our sales tax revenues coming in much lower, we also are going to lose a tremendous amount of money in that hold harmless area. So we've had just multiple things like that happen this year where our revenues are just not coming in as expected. And then like the rest of the world, our expenses are more. So everything's more expensive. The cost of doing business is just more in fiscal year 24 than it was in fiscal year 23. So you add those things together, it's not good math, right? So I'd have to look to Lee. I think the first pass budget was somewhere, was it $70 million, Lee? That we were looking at a $70 million shortfall between next year's revenues and expenditures. So worked really hard on the second pass budget. The whole county manager's office, budget office, departments were asked to make operational cuts, and we came in there. And now after the second pass meeting, there was a commissioner's workshop this Tuesday. I believe the number has been reduced down to like 28 million, but that's still pretty substantial. We also have not received the schools request. Buncombe County Schools, Asheville City Schools have not made their budget request of the county yet. So unless they're going to come in flat, right? We're looking for you inside information. Unless that's coming in flat, I think that will produce yet another discussion amongst commissioners of how to meet the school's budget request. So we continue to look for ways to balance the budget. As everyone knows, in North Carolina, both the state and counties must present a balanced budget as of July 1st. We can't deficit spend, hope for miracles and things like that.
I mean, I'm hearing what you said, but not being a financially knowledgeable individual. I'm just trying to get a paraphrase. Are you saying that the Department of Health and Human Services is highly dependent on revenues based on a tourist economy? And that since the tourist economy hasn't been good in the last year or two, therefore the taxation revenues are not so good? Is that what I thought I heard you say?
There's also a huge part of our tourist economy, money that gets funneled right back to the Tourism Development Authority.
Yeah.
All of the occupancy tax that does not come
Maybe I should stay
to
with
anybody else.
I think in a county that has a very large sales tax, I was saying is we typically have very robust sales tax.
Yeah.
And when people visit our county and they go to stores and eat at restaurants and things, it boosts, your sales tax tends to do better in a county that's visited more than like rural counties where mainly it's your residents that are buying things there. So that's where I think we benefit from a tourist economy. You know, when folks come in for a national tourist game from 5 counties around and then they go out to eat or purchase something here, we benefit from that as a county, you know. So that's where I think, I can't say that's why sales taxes are down, but I would say in the tourist economy, it's this way everywhere. Guilford, like most of the large counties, really lost a lot in Medicaid holdings this year. And I think it's just the economy. People aren't spending as much money because things are more expensive. And, you know, I'm no economist, but just my guess.
They're buying too much
I
online.
understand what I heard.
Yeah, and we
Not
buy a lot
locally?
online and you don't get local sales tax. That is a very good point. So like your money's going to Amazon. So the good news about our budget, where we stand now, start with the good news. I'm very pleased about this. We still are receiving some additional positions in the budget. So that's much needed. So we're still receiving 4 social work assistant positions in the budget, 1 call center person, and that's really encouraging given the number of volume of calls we have, and 4 income maintenance positions to do our energy program. So start with the good news. It looks like we will be able to, the only expansion that we have is we're going to expand our contract with ABCCM for Transformation Village. We're going to add a few more beds for mothers who are experiencing substance use disorder so that their children can live with them and avoid foster care. This program is a tremendous return on investment. It's much better financially and socially to keep that family together. And our outcomes in that program have been phenomenal. I mean, like, we should probably write this up and present it for an award this year. It's just really, really been good outcomes. So that's the only expansion that we have. And we also have adequate grant funding again this year to maintain our mobile team. And Krista, can you show that picture? I want you to see the long-awaited mobile health unit is sitting on Buncombe County soil. I just want to say,
Yes.
the tires are touching our pavement. This is a picture of our Buncombe County public outreach. So this will really allow us to take a program that's been so well received in the community and even do more. And I'm thankful that we have the grant funds to continue to maintain the
So
staff.
are you gonna have like a christening like they do for a boat?
We are actually going to have, Ellis is here, we are going to have a grand opening event for this bus, and you will all be
When?
invited.
So right now we are working we want to make sure it's in conjunction with a community event to really highlight how that partnership is so important out in the community. And so we are working on finalizing that date, but you will all get your very own invitation to please join us for that event and a ribbon cutting.
So.
Good.
This is just a little bit back before the vehicle. What if a parent in foster care does not want their children with them? Do they have that option, or is it a part of the process?
Oh, are you talking about Transformation Village? It's completely voluntary. So,
Okay.
yeah, it's a voluntary program. It really works nicely hand in glove too with Project Cara at MHEC. So these are typically mothers who are addressing their substance use disorder and need that support so that they can receive their treatment and stay with their children. I mean, all the research would suggest once you remove a child from a home, it causes, especially newborns, like some of these are babies. And so that mother-child bond gets to stay intact while that mother receives substance use treatment and these families are maintained. I mean, I think that's the beauty of the model. In fact, I've
Right.
never
I
visited.
totally agree.
It's, but no, we do not
What were you gonna say?
force it. We do not.
You need to
force it.
visit? What were you saying about visiting?
If you've never visited, I know someone that could possibly make that happen. If you've never visited Transformation Village, it's worth a field trip over there. I was so impressed when I got to go see the new facility and just the programming and it's really amazing. It's a great partnership we have there. And if you want to go, I really could, we can make that happen. Send me an email so I don't forget.
Stoney, I have a question. Like Dick, I work with an accounting deficit. I don't understand accounting. But getting back to what Philip was reporting a couple of months ago regarding public assistance, money's going out toward heating and air conditioning. I don't know if it also included food or housing, but my understanding in the big picture was we get a certain amount of money sent to us. We've taken on the responsibility of administrating that in-house, and that's overwhelming our existing staff and personnel. We've been given 4 more people to do that. However, we need 8. And whatever we do not funnel and put into our community, it goes back to the state. So on the accounting page, hiring people to administer that money is seen as a cost, but the money that comes in and then goes back to the state is not seen as revenue, correct?
I'm glad you said that, Greg, because I was going to transition to my concerns. I do have 2 concerns, 2 pretty major concerns with our current budget status. And I understand the position we're in, so there's really not a criticism or a judgment. But I have 2 really big concerns for health and human services next year. One is this community assistance team. As you all know, we took administration of those programs in an emergency in December. What we've been able to do this year, and this is in large part to our quality assurance team. So I basically repurposed staff away from their jobs to be able to do this year. And we are on target to distribute over $2 million this year into our community for heating and cooling assistance and other household emergencies to low wealth families and households. So that's amazing, especially when you look last year, remember we sent money back. So we're doing a really good job. We've done the math. Our contractor that we used to contract with that was struggling to do this program had 9 full-time staff in this program. And we have received 4. So next year, my challenge is to deliver twice the amount of benefits with half the staff. So I do want you to know, because I want to be transparent about this. And Greg, to your point, so there's a good chance next year I'll only be able to distribute $1 million because I can't distribute the funds without the staff. I'm putting it in a real life thing. We could get 100 people in one day who are coming in here with a cutoff notice or need a heating and cooling need. If I have 4 staff and one of them's out sick, and the state standard is that I have to turn that around in 24 hours. If you have an emergency, I have 24 hours to meet your need. I literally cannot process 100 applications in 24 hours with 3 people. So I am concerned about what I see as a capacity issue for our heating and cooling programs next year. And again, no judgment, it's just math. I'm a math guy. And so I do have that concern as a human services director. Yeah.
So you've brought up this concern before, and we're very well aware. And so this is like, the chances that you're going to be able to fix this problem with staff seem to be getting slimmer.
Yeah.
And so it seems to be incumbent upon you and your team to become innovative of what other solutions you have that we've talked about and brought up is reaching out to the community as partners to help your team in different ways so that you can utilize community partners to do work that you would otherwise have staff do.
Yeah.
And there are community partners that I think would be willing to do that if you had a coordinated way to engage them. And so I know you're thinking about that, but
Yeah, I
that's,
think
it seems like it's getting even more and more important that you implement that plan.
And my understanding, however, is because of it's how the government, state government administrates and accounts for those monies using the Fast Pass program, that if you're not a part of state government, your ability to access that Fast Pass process is inefficient. It doesn't work. So
there are still opportunities that could be done.
like what?
Examples of community.
Of ways that the community could help, even though they can't get into
Yeah, what
NCFAS.
Dan's talking about, and I think this is a model that we definitely are open to, is you're right, we'll have to approve the application. So like, only we could go into that state system and actually release the funds to the citizen. But our community partners could help with the application process. So if I went to ABCCM, if I went to a community provider or Eblin or any one of our community partners, Jewish Family Services, and said, my light bill is due tomorrow, I cannot pay it, I'm gonna be without heat, and by the way, I have to have oxygen every night to sleep. Right, that's a crisis. That's a heating, cooling crisis. Gotta be solved in 24 hours because your light's gonna be cut off tomorrow. Our partner could actually take that application, help the citizen in their office apply online for, no, Kelly told me they couldn't help them apply through ePass.
ePass must be set up individually. You must have your own account to do an ePass application. So each individual person, now they might be able to help them navigate the computer system, but that actual individual will have to do that application online. Yeah. So that's
And then the
not a,
application would come to us.
yeah, so you can't.
Person can't
be
pay
an
their light bill and they don't have
agency doing that.
oxygen. They got to go online to.
Yes.
That's where the community
Also,
partners still
in
can
order to
help.
do ePass,
do
you
the
must have an
application. We're
email
doing that with
address, so that's a potential barrier because you must be able to have an email set up, which emails are free. A lot of emails are free, but you have to set up an email. You have to be able to access that email. You have to be able to enter that email as a contact information. So there's lots of different pieces and ways that our residents have to do it in order to do ePass. I will say that by and large, the vast majority of our volume came via telephone. Our telephones were overrun with people that would be able to apply online, and we can actually take those applications online now, and we can do a telephonic signature. So that was way more than 50% of our applications that came in were through the telephone. Probably about 30% was ePass. We have noticed that, of course, as those that we serve are getting younger and younger, they're more computer savvy and they don't have issues with having email and access and things because you can do it on your phone if you know how to do it. But then we would have those typically our non-English speaking clients that would come in face-to-face, as well as those that are just elderly and like to be able to have that face-to-face contact. That's how they've done and how they've operated. So there are some barriers to having partners, just not having the access to be able to navigate the different pieces.
So to Dan's point, we are open to community partnership. I mean, I think that's what we'd be open to that if we were overstaffed. Because I think I'm a big fan of people being able to get access to services wherever they are. And it's also a part of we can report on this later, but also a part of our push to really try to maximize the NC Cares 360 system in Buncombe County. And HHS wants to be a driver of that. ABCCM, especially their veterans, is a big driver of that. So we're trying to really get that, that sort of like, I don't even know if I like the word no wrong door. No, I like the word any right door. Like, so anywhere you go for assistance, you could get connected. But I guess I just want to share with the board my concerns so that you won't be surprised next year if this happens, that it's a math issue and 4 staff are not going to be enough for us to administer this huge program. But we are going to be creative. We're looking at things I could do. I just heard of some funds this week that might come down from the state for social services that are leftover ARPA funds. If I can get those funds, my hope would be able to at least hire temporary staff for 1 year to get me through, because you can't hire permanent staff with temporary funds. It's a bad idea. And then the next year you have to lay all those people off. So we're working on it, but I want you to know the challenge. The second challenge I'm concerned about in the budget, and I want my board to be aware of this, is the safety of this facility. So I'm genuinely concerned about the safety of our visitors and our staff in this building. So over the past 2 years, we have threat assessment teams if someone is threatened in any way. We're having at least 2 threat assessments a month. We went through one period where we had 7 in 10 days. Our deputies are having physical interactions with visitors to our building. We have illicit drug use going on in our stairwells, in our bathrooms. We have weapons coming in and out of our building with no way to know. We have removed axes, knives, machetes off of visitors from backpacks. We've had staff assaulted in our building. And so I just need my board to understand that the staff who work in this building are not feeling safe at work. And 2 years ago, when we redesigned this building, we made a plan to make the building more secure. And then we have a county safety officer, and when he came on board last year, I had him come and do a walkthrough to do a facility safety assessment of our building. And he actually recommended the exact same thing we have put in the blueprints. That was approved for our budget. And as a part of the reductions, we've taken that out and moved it back a year. But I guess I just publicly want this board to know that I don't feel, we have 65,000 visits a year in this building. That's not counting the staff who come in here every day. And it troubles me that I no longer feel like they're safe. And so if there's anything we can do to make that happen, I feel like that we owe that to I have a lot of vulnerable citizens who come. And I don't want to send the message that our visitors are bad people, but we're a health and human services agency and we serve people in bad situations. And sometimes when you're in a bad situation and you're struggling with substance use disorder or PTSD or behavioral health issue, broken relationships, perhaps you don't have access to your children. Sometimes that can get difficult. And our staff are really good at de-escalation, but we're not trained to defend ourselves.
So for clarity, the budget is paying for this, or it's not going to pay for
It
the
was in the
upgrades
budget,
needed?
but it has been removed.
It's been removed. They're not paying for it.
Yeah. I have serious concerns about delaying this for another year. And I don't mean to be dramatic, but in 2 months, a 2-month span, we had 3 people arrested and jailed for communicating serious threats in this building. One of which the FBI got involved in. So I'm not trying to be an alarmist. I'm trying to be a realist. And I just want my concern to be public that I feel like safety has become a pretty serious issue at 40 Cox Avenue.
Would that not be a liability if an employee was harmed at work because their safety was not, wouldn't that be a major concern of commissioners, that employee safety, if an employee sued because they weren't, I would think that would be, a huge liability. And then my other question, unrelated, that was just spontaneous concern. I'm naive to that, partnerships with Dogwood Trust. What is your responsibility in identifying new revenue streams to help, like and how did those, like, does it go into the county bucket or can it be earmarked for Health and Human Services? Like, what are those relationships with decisions made by the commissioners?
Yeah, I can't speak, well, I can't speak for commissioners. Number one, I really can't even speak to the liability issue. Kirkland could speak to that if he was comfortable. I usually come more from a position of responsibility. I feel responsibility for the safety of the people in my building. In terms of Dogwood, I guess I've not thought of seeking outside resources because it's a capital need and it's not something that I normally would see Dogwood funding would be a facility need. We have used Dogwood, been great partners with us around service delivery. And Dogwood's invested heavily in Buncombe County service delivery. They're a wonderful partner of ours. I don't know. I wouldn't be shy to ask anybody. It's very important to me.
And did you mean Dogwood for the gap in the electricity and?
Any of it, even like,
Yeah.
foundations are great because they're so flexible for even capital needs.
I mean, if you're, but I mean, I think you raise a good point. If you're at risk for sending $1 million back, could you ask Dogwood saying, hey, will you help us keep this $1 million in the county? We need your help, you know, to give us a little bit of money and help and assistance, emergency assistance to keep the $1 million for residents of the county. We're at risk for losing it. They might be willing to have that conversation and help.
We'd be glad to talk to them. It's a great.
Is there any
It's a good idea.
policy that county funded organizations can't seek outside?
We have all kind of grants.
Great.
Yeah,
Great.
we just have a grant process we have to go.
So in light of the safety issue, what can the board do to do something about this? I mean, is it a letter from the board that would then speak to that issue to the county manager or to the board of commission? Or I mean, is there anything, what can we do as a board in light of that safety concern?
The board was so inclined that I think contacting David and trying to make the decisions would be.
Such as county commissioners?
And this is new for me, so is that we draft it together and sign off? How's that process work? Because I'm coming from a public school lens, and what you're saying translates immediately to our everyday, and it's a now concern. So how do we write that letter?
Typically, and we can do this anyway, but typically what happens is the exec committee works on something and brings it to the board for approval. Isn't that how we usually do it, y'all?
Yeah.
That would facilitate things, I think.
I mean, would that be helpful if the board sent a letter of concern to the commissioners on these two issues?
I think so. And that, like I tell you from the time that you get your new employee orientation, every time, you really are the commissioner's appointees to advise and develop programs for the HHS. So if you feel like people coming in here are not safe, then I think your voice is very valid because you are an extension of the commission.
But Stoney, I think though that the board, I mean, I'm just saying this because I get the idea that there's there, but you know, there's the, you know, what constitutes unsafe and what things in the budget do you need to increase the safety of the county? I don't think we want to sort of be running around just, you know, leaving that thing that 40 Cox is unsafe out there. I think that we would rather, it would be more important to phrase things saying that there are certain safety issues that we need to improve on, and by purchasing a, you know, a weapon, a metal scanner, you know, I don't know specifically what you're wanting, but I just don't think that laying that whole, it's unsafe out there, because I think that's true, send sort of a weird message, because we do our best to try to make this a safe environment. And there are, I know, because I deal with a majority of these situations with you, but I don't think that you want to be saying something that's not really data driven. But I also think that you should be making things of, if there are specific requests that we need, I think that would be better.
Yeah.
As opposed to just general, it's unsafe.
I think that's a great point. Maybe that ask, if you will, is to support the safety solution. So here's our safety
Threat
solution.
assessment
Our
plan.
solution, which was designed by that safety officer, who is the county safety officer. And for those who take a tour, I can show you today, it's basically to take our visitors, like we have our like visitor desk, our greeter desk.
No.
We're basically gonna take that and turn it perpendicularly, so it basically forms a sort of a natural barrier. Then we're gonna put, to the right of that will be your only point of egress into the building. And we would install a system that is really it's not a metal detector, it's a whole different thing, it's a weapon detector. So what it does, you don't have to empty your pockets, you don't have to put anything on a conveyor belt. I would say this, if you've ever been to the Biltmore House, you walk through one of these. If you go to a concert, you very likely walk through one of these. I went to a Carolina Panthers game last year, walked right past them. You really wouldn't even know it was there. So it's different than a metal detector, but what it does, it reads, it scans bags in your persons, and it picks up shapes of objects. And so what it's looking for is anything shaped like a weapon, a gun, a knife, anything like that. Then a security officer, if you show up, they just take a stick, look through your bag, let you go on in. So you catch weapons at the front, and then you just ask people to please take them to their car or whatever, because we have a county ordinance that you cannot carry weapons in the building like this. That's already in policy. And then we would move our deputy up to the front of the building, and we would in essence create a public lobby. So like that also would create a small public lobby for anyone to come into. But to go through that greeter, and we still have our greeters up there, they're a big part of our customer model. To go into the private part of the building, so to speak, you'd have to be a customer. So like your customers only, after that space. And then what our deputies feel like is that allows them to know who's in the building, to know who has a weapon. It also is another de-escalation point. So we have folks that are upset when they come in. I understand that. So that's your first chance to de-escalate a little bit, decompress at that natural stopping point. Your second place is at the front desk. All our staff are trained in this. But by the time you get in a closed door room with a nurse or a social worker or a public assistance worker, now you're at your third chance to de-escalate, or your veteran service. So like, it really is a strategy as well as removing like obstacles that we don't want to come, into a closed door office. So that's the strategy. We've also put in badge, we've designed our building now so there's portions that are only accessible to staff. And then we have portions that are our interview spaces. Well, that allows us to concentrate our security staff where interviews are going on, and they're not in parts of the building that are just staff only. So it lets us make better use of our security officers as well. So it is, thank you, Kurt. We have a logical strategy as designed by a security professional. We just really need the funds to pull it off. It's about $365,000. It's a pretty big lift. But what I would say, it'll last for 10 years. So if 65,000 people come through here a year, in 10 years, a pretty small investment, I think, to make sure that folks are safe and comfortable in this building.
Well, why don't you gather those data and specifics that you shared with us at the beginning of this discussion and include what Kurt's pointing out, our strategy about what we feel like would be reasonable to mitigate that risk. And then let's discuss it at the exec committee, formulate a letter, and then discuss it at our next meeting.
Is that timely enough, Stoney?
Yeah, I think, well, we weren't gonna do it till July 1st.
Okay. Great.
Thank you. I appreciate that. That's all I have.
Okay, and I will keep my chairperson report very short and sweet. Exec will be interviewing a candidate for the engineer position on the board at our May exec meeting. So we are hopeful that in May we can bring forward another candidate, and then we would have a full board with all of the mandated seats filled. All right, so would anyone like to provide a motion and a second to adjourn? And if you would like to stay for a building tour, you are welcome to.
Move to adjourn.
Thank you, Dan. Thank you.
Thank you.
All right, all those in favor, please adjourn. Thank you all so much.